Okay, so for cranial nerves 3, 4, 5, and 6, I'm going to be using the right side of my foam head here. First off, to start, the cranial nerve 5 sensory distributions, the 3 branches and the areas and structures they innervate. So the V1 branch of cranial nerve 5, which is the ophthalmic branch, it's identified by this green outline up here, this top portion. This innervates structures like the eyes, the conjunctiva, the lacrimal glands, the nasal cavity, frontal sinus, the upper eyelid, and anterior parts of the scalp as well. The function of the V1 branch is for somatosensory to the eyes, the sinus, the scalp, and lacrimal glands. The V2 branch of cranial nerve 5 is identified by this orange outline, this middle area here. This is the maxillary nerve. This innervates the nasopharyngeal mucosa, the palate, the nasal cavity, the teeth of the upper jaw, the lateral portion of the nose, the cheek, as well as the upper lip, and the lower eyelid. The function of the V2 branch is for somatosensory to the face, the teeth, the nasal mucosa as well. The V3 branch of cranial nerve 5, which is the mandibular nerve, is identified by the purple outline here, this lower portion. The sensory portion of this nerve innervates the lower lip, the lower jaw and teeth, the preauricular and temporal areas, and the motor portion of this nerve innervates the mastication muscles, which is the masseter right here, and various muscles of the ear, such as the tensor tympani and the anterior digastric muscles as well. The function of this nerve is for somatosensory to the lower 1/3 of the face, and for motor innervation to the muscles of mastication. So the masseter muscle is identified by this red rectangle here. The mandibular nerve is the nerve that innervates this muscle. The muscle innervates from the zygomatic arch of the cheek here, and then it inserts along the angle and lateral surface of the mandibular ramus. So the mandibular arch here, this corner, it'll insert along this area down here. When it comes to electrode placement for cranial nerve 5, we use EMG. Bipolar montage is preferred for cranial nerve 5 monitoring, and masseter monitoring is the most common. So when placing electrodes, we commonly are going to palpate the cheek area to identify where the mandibular angle is. The mandibular angle is commonly felt as like your jawbone, this little like L-shaped corner here of the jaw. So you're going to move, once you find the mandibular angle, you're going to move 2 to 3 finger breaths upward and then forward as well to make sure you're in the belly of the muscle. And when it comes to needle insertion here, you're going to want parallel needle insertion. So we're going to make sure we're in the belly of the muscle, and then making sure that those needles are parallel to each other, like typical EMG, like so. So for cranial nerve 3, the muscle we are going to be monitoring from is the inferior rectus. So in order to identify this, with the patient's eyelid closed, we're going to gently push up on the eyeball, and the needle is going to be placed basically at the midpoint of the inferior orbit. But when placing the needle, we're going to want to make sure we're pointing it away from the eyeball so we don't stick the needle into the eyeball. So we're going to identify the inferior orbit, and then we're going to point the needle slightly downwards in that basic general area. For cranial nerve 4, we're going to be monitoring from the superior oblique. So in order to identify this with the eyelid closed, you're going to gently push down on the eyeball, and the needle is going to be placed slightly medial to the midpoint of the superior orbit here, and the needle is going to get inserted into this space directed slightly medially. Just like so, slightly medial. And lastly, for cranial nerve 6, we're going to be monitoring from the lateral rectus. So in order to identify this with the eyelid closed, we're going to gently push the eyeball medially. And basically the needle is going to be placed at the corner or the midpoint of the lateral orbit here. And the needle's we're going to want to make sure it's pointed slightly away from the eyeball again. Just like so. Now, commonly when monitoring cranial nerves 3, 4, and 6, referential montage is used since the muscles are so small. And the reference here is typically placed on the lower forehead. In this situation, it's common that one reference needle is used for multiple muscles. So for the second half of the head, I'm going to be using the left side of the foam head here in order to identify cranial nerve 7. So to start, cranial nerve 7 and its pathways. So starting off, when we start with the posterior auricular branch, which isn't identified on here. The posterior auricular branch will run through the parotid gland, which is this yellow structure here. And from here, the 5 major extracranial branches are formed, specifically starting at the stylomastoid foramen, which is identified with this little X here. And all the branches are identified with this red pen, as you can see. So to start, we're going to start with the temporal branch, which is the branch that is running up through here. You can see that the temporal branch innervates this frontalis muscle, which is identified with this pink rectangle here. And then the temporal branch also innervates the orbicularis oculi along with the zygomatic branch. So these two branches work together to innervate the orbicularis oculi, which is identified with this purple circle here around the eye area. Next, the nasalis muscle, which is this little blue rectangle, is innervated by the zygomatic branch here. Next, we have the orbicularis oris, which is this brown circle. This is innervated by the buccal branch running along here. Next, we have the mentalis branch, which innervates the mentalis muscle, this green structure here. And lastly, we have the cervical branch, which is this little branch here, which innervates the platysma, which is this huge black rectangle here. Now, when it comes to electrode placement for each of these muscles, bipolar montage is preferred because it provides the most specificity. First, we're going to start off with the frontalis muscle. When monitoring here, we go to the middle of the muscle. To first identify, we're going to go about 4 to 5 centimeters above the center of the orbit. So the center of the orbit is about here, and we're going to go about 4 to 5 centimeters above that, kind of in the belly of the muscle towards the middle. And we're going to make sure to keep parallel here, like so. Next, we're going to go to the orbicularis oculi. Needle insertion here is going to take place over the front of the eyebrow. We're going to go lateral to medial here. And with the orbicularis oculi, we can, for the second needle placement, we're going to go the same trajectory, lateral to medial, except now we can go below the eye as well. So we are going to different spots in the muscle, one above and one below the eye. like so. And then next for the nasalis, the needles are going to be placed in the lateral aspect of the nose, placed lateral to medial, but we're going to want to make sure we're not crossing the midline of the nose. On the foam head here, the midline is represented with this black line. Like so. Next, we have our orbicularis oris. So this is similar to the orbicularis oculi, where one needle can be placed above the lip and one can be placed below. The trajectory is the same, where we're going lateral to medial with our placement as well. Like so. Next, we have our mentalis. This is similar to the nasalis, where we're going to be placing them lateral to medial, making sure to not cross the midline of the muscle. Like so. And then lastly, we have the platysma. We're going to want to aim for the belly of the muscle, usually going about 4 to 5 centimeters below the mandible. Considerations for this muscle, since it is along the neck area, we're going to want to make sure we're not hitting any blood vessels such as the jugular. So before placing any needle electrodes, it's important to palpate to feel for any pulses, because you don't want to insert the needle into any blood vessels. So when you're going to want to make sure you palpate and making sure you don't feel a pulse or anything, and then when you feel it is safe to insert the needles into the belly of the platysma there. Just like so.